Welcome to Week 2 of the DPS Usrn Nclex Success Track, focusing on the safe and effective care environment. This week, we'll learn how nurses protect patients, promote safety, and lead care teams through effective delegation, prioritization, and infection control. Remember, every Nclex question connects to one central idea: patient safety. By the end of this week, you'll be able to identify the key principles of patient safety and professional ethics. Apply the 5 rights of delegation and frameworks like ABCs and Maslow's hierarchy. Recognize proper infection control and isolation precautions. Differentiate the scope of responsibility among RNs, LVNs, and UAPs. These skills are essential for safe practice and high performance on the Nclex. Week 2 combines 2 of the most important Nclex categories. 1. Management of care leadership, delegation, supervision, and teamwork. 2. Safety and infection control, protecting patients and preventing harm. You'll also strengthen your understanding of prioritization and documentation, 2 topics that appear frequently in NGN-style case studies. Together, these concepts form the foundation for clinical judgment in real nursing practice. Delegation is one of the most tested leadership concepts on the Nclex. It means assigning specific tasks to another team member while maintaining accountability as the RN. Always follow the 5 rights of delegation. 1. Right task. 2. Right circumstance. 3. Right person. 4. Right direction or communication. 5. Right supervision and evaluation. RN handles assessment, teaching, and clinical judgment. LVN/LPN cares for stable patients and gives routine medications. UAP performs ADLs, vital signs, and basic hygiene, but never assessment or education. Delegation keeps care efficient, but patient safety always comes first. When everything feels urgent, how do we decide what to do first? Nclex uses 4 major prioritization frameworks. 1. ABC's airway, breathing, circulation, life first. 2. Maslow's hierarchy, physiological needs come before psychosocial. 3. Safety and risk reduction, prevent harm before comfort measures. 4. Acute versus chronic, address acute and unexpected changes before stable conditions. Example: a patient with shortness of breath, airway problem, first priority. A patient with fever and mild pain, lower priority. Critical thinking and safety are always the deciding factors. Infection control is a cornerstone of nursing safety. Follow the 4 main types of precautions. Standard hand hygiene and gloves for all patients. Contact gown and gloves E.g., C. Diff, MRSA. Droplet surgical mask within 3 feet E.g., influenza, meningitis. Airborne N95 respirator, negative pressure room E.g., TB, measles, varicella. Always use PPE in the correct sequence: gown, mask, goggles, gloves when putting on, and reverse when removing. Infection prevention protects not only patients, but also you and your team. Nurses are legally and ethically accountable for every action we take. Know your responsibilities. Respect patient rights and obtain informed consent. Follow HIPAA guidelines for patient privacy. Document care accurately and promptly. Report incidents or sentinel events immediately. Advocate for your patients even when it's uncomfortable. Ethical nursing is about doing the right thing even when no one is watching. Let's apply this to real-life decision-making. When deciding whether to delegate: 1. Assess the patient's condition. 2. Is the patient stable? 3. Is the task appropriate for delegation? 4. Give clear instructions and expected outcomes. 5. Supervise and evaluate results. You can delegate a task, but you cannot delegate accountability. The RN remains responsible for the outcome of every delegated action. Let's test your judgment. A UAP reports that a postoperative patient's dressing is soaked with blood. What should the RN do first? The correct action is to assess the wound immediately. Assessment cannot be delegated, it requires professional judgment. After assessing, the RN can reinforce the dressing if needed and notify the provider. Always remember, when in doubt, assess first. To summarize Week 2, patient safety is always the top priority. Use ABCs and Maslow's hierarchy for prioritization. Delegate wisely: right task, right person, right situation. Follow infection control protocols consistently. Protect privacy and document accurately. These principles will appear in every Nclex scenario and in your daily nursing practice. Thank you for your dedication to safe and compassionate care.